Dr. Ho-Sung Choi, who will be speaking on keeping up with new aesthetic trends, including the neck and decollete rejuvenation using PN mesosolution combined with threads. So we welcome Dr. Ho-Sung Choi. He is the director of Planet Clinic. He's the chief academic director of the Korean Aesthetic Surgery and Laser Society. And he's the author of a book on skin. Oops, I'm sorry. He is the author of Skin Rejuvenation book as well. So welcome, Dr. Ho-Sung Choi.
Hello everyone. It's really nice to meet you. I'm Dr. Ho-Sung Choi from South Korea. I'm a cosmetic surgeon. Above all, it is a great honor to be invited to this great GEM seminar, the first GEM seminar as a speaker. Today I'm going to talk about neck and décolleté rejuvenation using PN mesosolution combined with pediocox threads. For the past 10 years, I've been participating as a consultant and training instructor of filler injection and thread lifting. These days, most women are good at taking care of their faces, but relatively often neglecting their neck care, which causes an abrupt transition between the treated face and non-treated neck. The need for neck rejuvenation is increasing, especially in these days, because these days we are wearing a mask every day, all the time. The changes that occur as the neck ages are as follows. In most cases, the condition of the neck requiring treatment is in these three changes. Unlike the skin laxity of the neck, horizontal necklines are not necessarily caused by aging. Rather, they are more closely related to genetic propensity or sleeping habits or the long-term use of mobile phone. Skin changes in the décolleté area are also attributed to environmental causes such as smoking, dehydration, sun exposure, and collagen reduction caused by aging, and other causes such as as follows. Neck rejuvenation basically requires a multi-layered, multimodal therapeutic approach. Basically, treatment is performed from the deep layer to the superficial layer. Among them, today I will focus on PN, which is polynucleotide, and pedio thread. Now let's talk about neck and décolleté rejuvenation using PN mesosolution. First, let's look at the difference between PDRN and PN. PDRN is made from small pieces of DNA extracted from trout sperm and has a powerful regenerative effect, which promotes wound healing and tissue regeneration. Polynucleotide is made from pieces of DNA extracted from salmon sperm and has a molecular weight of 3 to 5 times larger than PDRN. So it has some viscosity. PN not only has the regenerative action that PDRN has, but also provides the 3D remodeling of the dermis through the scaffolding effect, which is the basis of the anti-aging effect. Clinically, efficacy of PN includes face and body skin rejuvenation by dermal remodeling, and stretch marks and scar improvement, and also hair loss treatment. It is also commonly used to address the side effects after cosmetic treatments, such as skin necrosis. Now let's look into V10 PN, the product from Jetema. V10 PN is a mixture of PN and non-cross-linked HA. The appropriate injection depth is the mid to deep dermis, depending on the product. It is recommendable to inject at least 5 times at 2 weeks intervals to maintain good skin quality repeat treatment sessions every 2 to 3 months, depending on patient's skin condition. In general, the early changes that can be seen after V10PN treatment are softening of the skin texture from moisturizing effect and skin brightening. And after 2 to 4 weeks, patients feel skin tightening effect. And after 1 month, after 3 sessions of treatment, we can see a pore size reduction effect, and also optimal volumizing effect can be seen. These photos are before and after from a clinical trial to evaluate the efficacy of V10PN. There was a noticeable improvement of the skin texture and skin tone after 3 treatment sessions. Another clinical study to evaluate the sebum reduction rate after V10PN treatment using Janus camera. The results showed that V10PN markedly reduced sebum production. So we can think about V10PN to use for anti-acne treatment or anti-pore treatment. V10PN is also effective to rejuvenate the neck skin, although the improvement rate is a bit slower than the face. Repeated treatment can provide a noticeable improvement in neck skin laxity as well as horizontal necklines. In this case, I used both 33 gauge needle and a multi-needle injector. In this case, V10PN was applied to rejuvenate décolleté using serial puncture technique with 30 gauge needle and multi-needle injector. After 5 treatment sessions, her chest wrinkles have much improved. The optimal target layer for V10PN injection is the deep dermis, which is located between 1.5 and 2.0 millimeters depth from the skin surface. However, since our patients are mostly over 30 years old women, these are the appropriate injection depths for each site. When injecting V10PN, you can use either a 33 gauge short needle or a multi-needle injector, and both methods can be combined at the same time. A multi-needle injector may be useful for those who are not familiar with manual injection, and using the injector, the injection pain can be more or less reduced, and you can finish the injection much faster than manual injection. The following shows the appropriate injection depths for V10PN. Since 33 gauge needle has 4 millimeter length, assuming that the needle is fully inserted into the skin, the final depths by the angle of injection can be roughly obtained through mathematical calculations. Therefore, V10PN should be injected with an injection angle of between 15 to 20 degrees. When you lift up the inserted needle and the skin looks white, the needle is located in the right depths. However, if you see gray color, then you should think about that the needle is placed too superficially. It is important to repeat at least 3 sessions at 2 weeks intervals and 2 more sessions at 1 month intervals. So 5 sessions, totally 5 sessions for the initial treatment. And the effect will be accumulated as the sessions is repeated. And this accumulation of collagen in the dermis will show the effect. So to maintain good results, it is advisable to repeat treatment sessions at 2 to 3 months intervals. Now, I'm going to show you a short video about neck injection technique using V10PN. First, I start to inject into horizontal necklines. Normally, a person has 2 to 3, sometimes 4 necklines. When injecting into the line, I inject at higher density, that is a little more amount of V10 PN per point. And injection points are more closely together so as to get more volumizing effect. Then the remaining 2 ml, so I usually use 1 ml to fill the whole lines. And after finishing the line injection, I start to inject to the area between the 2 lines, so the remaining areas. And when injecting between lines, I inject more superficially and less amount of product per point. You see, I'm using 33 gauge 4 millimeters length short needle, and I didn't insert my needle fully because neck skin is quite thin, so it's better to inject very superficially than the face. And I often use a multi-needle injector as well. It is especially more convenient when treating the neck and décolleté. See, when I use the multi-needle injector, this injector has a negative pressure to avoid any product loss. And for the décolleté, the injection method is similar to that in the neck. However, the skin is a little thicker than the neck, so you can inject the product a little deeper. Also in décolleté, multi-needle injector is really convenient to use. Okay, let's move on to the second topic, neck lifting using pediocox threads. First, let's have a look at the anatomy of the neck. The thickness of the neck skin is between 1.0 and 1.5 millimeters. The subcutaneous fat layer is quite thin, and there is platysma muscle underneath this thin fat layer. When pedio thread is inserted, the optimal target layer is this thin subcutaneous fat layer. Since there are many large veins within the muscle layer, it's important to keep the cannula very superficially at the subdermal layer to avoid any bruising or hematoma. This is a conventional pattern design for the neck lift. However, this pattern has some limitations in terms of effectiveness. To overcome these limitations, I recommend to use reverse insertion technique that is called occipital lifting technique. A thin and medium length cock thread is appropriate for this technique, and occipital lifting is less affected by the neck movement and has less risk of thread migration because threads will be placed in the area of very dense soft tissue. I recommend to put at least 5 threads to create a strong and secure fixation. It is similar to the movement of the body by this fitness equipment, assuming that this point is the entry point of the thread or the moving point, and the fixing point will be dense soft tissue. So the neck skin will be moved like this body. In my opinion, epiticon thin is a very suitable thread when using this technique. This is because this thread is thin and flat with a very appropriate length of 8 centimeters, making it easy to insert into a dense tissue, soft tissue with narrow space. epithelium thin has a high density due to strong pressure during the manufacturing process without heating during sculpting process. This because heating process usually weaken the thread. As a result, it has a very strong tensile strength. As you see in this graph, although the USP size of this epithelium thin is 4.0, it has the same tensile strength equivalent of a conventional 2.0, USP 2.0. So it's very thin but very strong. Now I'll show you my second video about neck lifting procedure. This patient is the same patient who was just injected V10-PN. Entry points are marked along the vertical line from the mandibular angle. And the vector is parallel to the jawline. So you start from the very lateral and you go far more lateral toward the hairline. Entry points, usually to puncture the skin, I prefer to use an owl for skin puncture because it has less risk of scarring than compared to 18-gauge needle. And since the area where the threads are to be inserted is a quite rigid and dense tissue, injecting optimal amount of tumescent containing epinephrine will facilitate smooth advancement of the cannula, and it will reduce pain and bleeding or hematoma. The cannula tip should be inserted almost perpendicular to the skin surface in the beginning, and then it should tilt the cannula down to reach the right depths, almost horizontally or parallel to the skin surface. So your cannula should be advanced constantly into the subdermal layer. However, sometimes we can feel some resistance when advancing the cannula. Then you should not push or advance too strongly. Rather, you should rotate or vibrate the cannula, then it becomes easier to advance the cannula. And always use the other hand, supporting the insertion and checking the depth of the cannula during the process. The cutting process, just pull the thread towards the hairline to give some tension and gently press down with your scissor and just cut. After 2 weeks, her neck and décolleté became brighter and smoother. I'm going to talk about combined treatment modalities to enhance neck and décolleté rejuvenation. HIFU helps increase the elasticity of the neck and décolleté skin, and it usually precedes other treatment modalities when combining various treatments. Botulinum toxin injection is one of the most commonly used treatments for the neck rejuvenation. It improves platysmal bands and horizontal necklines. I usually inject twice at 1 month intervals. If the patient has deep horizontal lines, it is recommended to fill them with a soft HE filler using 33 or 34 gauge needle through multiple microbolus serial injection technique. After V10, in addition to pediocoque threads, braided type or monofilament pedio threads are also commonly used for neck rejuvenation. After V10-PN treatment, her neck lines are improved and her neck skin became brightened. In mild cases of neck lines like hers, V10-PN treatment alone can provide nice results. However, when it comes to neck skin laxity, we should consider combining other treatments. After 3 months, her neck skin looks firm and brightened. This is my last case. The older the patient is, the more treatment modalities are required. So despite the short longevity in elderly patients. Most are really happy with the result. This is my last slide and my conclusion. Pre-assessments of horizontal necklines and platysmal bands is really important, and customized therapeutic approach according to the degree of the neck skin laxity is very important. And also, you should inform your patients about cumulative effect of PN treatment. And PDO cox threads can also play an important role in neck rejuvenation. In most cases, as I do in my clinic, multimodal approach is always right, and it's always right to achieve better results of neck rejuvenation. Okay, that's it for my lecture today. Thank you very much.
Thank you so much, Dr. Hosang Choi, for sharing your insights on neck rejuvenation. We have heard throughout this meeting about the importance of multimodal treatment, the combination of HA filler with PDO threads, and now we're looking also at meso treatment. And this is a strength of the Jetema portfolio, that it's very broad-based. It has all those components to it. And of course, in due course, there will also be toxin added, so it will be a very complete and unusually complete portfolio when we look globally at the offerings that are available.